for the first time, but to those who are meeting for the first time here, welcome. And what we're going to do is the agenda will be simply we're going to hear from Ms. Cassidy Ison. I hope I'm pronouncing that correctly. Ison. And she's with Black Girls Rising. She's going to give us a presentation. She also does some work with Families for Louisiana Incarcerated Children. And then we're going to hear from Dr. Cade Brumley with the Department of Education, and then Dr. Dana Hunter with the Children's Cabinet. So with that, I'm going to ask Ms. Cassidy if you're ready to go ahead and give the commission some remarks.
Hello, my name is Cassidy Ison. I'm a senior at Eastern Charter High School. I am 18 years old. I am also a part of Black Girls Rising, one of the youth leaders, and I am with Families and Friends of Incarcerated Children. I just wanted to say that, well, explain like my story, I guess you could say. I got involved with FLIC like in my seventh grade year. I was having trouble in school. I was passing all my classes, but they just had this one teacher that wouldn't really pass me, and she wouldn't grade any of my assignments correctly. So it was making me like my grades kind of be really low. And so when on the first day of school of seventh grade, well, she did that for like 3 years in a row, 5th grade, 6th grade, and 7th grade. The first day of 7th grade year, I went to school and they were like, "Oh, you're not in the correct grades, and this and this." So we had to get FLIC involved, but FLIC was already involved with my brother, with his situation at NOCA. He was having some of those similar problems. So I'm just really thankful for FLIC, because if not, I feel like everything wouldn't went the same way that it's going now. And yes, I'm still in here. We still have all the same girls that are participating in the program, and I'm just really grateful that I met everyone that is participating in FLIC and Black Girls Rising.
Thank you, Cassidy. I really appreciate your work and you spending some time with us today to share a little bit about your story and the impact that this work has had on you, and now you're making a positive contribution to the work that we're doing. So thank you for your involvement and leadership. Do you have any questions for any of the commission members or any other further discussion?
No, not at the moment.
Not at the moment. All right, understood. Okay, so next I'd like to ask Dr. Brumley with the Department of Ed, if you wouldn't mind sharing some remarks. I had sent some questions prior to that I think were set the tone and kind of prime today's discussion around juvenile justice and the reform efforts that we're making here as a state, or trying to make rather. So I'd like to give Dr. Brumley an opportunity to address the commission. Thank you for being with us too, Dr. Brumley. We really appreciate you taking time out of your schedule.
Yeah, thank you. Thank you, Representative Duplessis. I always appreciate our conversations and your leadership. Before I get started, I would like to just acknowledge a couple of members of our department team who are also on the call. We have Dr. Kelly Peterson, who is on the call, who's our Assistant Superintendent for, yeah, there she's waving. Hi, Kelly. Our Assistant Superintendent for Equity, Inclusion, and Opportunity. And also we have Dr. Keith Leger, who's our Assistant Superintendent basically for policy and governmental affairs. So happy to have both of those individuals on the call, and personally and professionally, just super thankful for the work that they do every day to help our organization, our agency. Representative, I'll just start by a few opening remarks, and then we can go into any specifics that you may have. But you know, I look out across the country and I see news stories of you know, different states and cities and those individuals trying to figure out, you know, how do we one, keep kids and employees safe, and number two, how do we string together some form of educational system during the middle of a pandemic? And I just can't help but be really proud and thankful for the entire educational community across the state of Louisiana, because I will put what we, and I don't mean me, I really mean everyone, from kids and teachers and parents and communities and leaders, have done up against anything in this country. Early on in the pandemic this summer, we set forth some mitigation efforts that if schools wanted to reopen, they need to follow these basic themes such as sanitation and group sizes and number of students on a bus and face coverings and temperature checks and a whole host of things that schools needed to do in order to reopen. And so, we have since then had medical experts continue to confirm that our schools are one of the safest places that kids can be, so long as we keep those mitigation efforts up. And as of today, we have just over 70% of our students benefiting from face-to-face instruction across the state every day in a brick and mortar facility. And we still have the option for kids to be able to be fully virtual if they have a need to do that or their parent wants to do that. And so we have been able to provide options. And as you've seen community spread go up or down, or positivity rates go up or down, you've been able to see systems in Louisiana toggle back and forth between, more aggressive in terms of being in person versus virtual versus hybrid. So it has no doubt been a stressful and imperfect year for the educational community, but looking across the nation, I'd certainly put our work up against anything I see, and that's not just bound by a pandemic. We have also had one of the most aggressive hurricane seasons that our state has seen, and also most recently winter storms that have plagued really the entire northern half of the state. So it's been a challenging year, but I'm really thankful for the work that educators and leaders have done across the state. And Representative Duplessis have always appreciated your leadership at the Capitol, and I'm happy to take any general or questions you may have.
Thank you, Dr. Brumley. What I'd like to do is, I do have a couple questions, but what I'd like to do is give members of the commission an opportunity to ask any questions that they might have. So I'll start with Ms. Womack. If you have any questions, or any members of the commission, any specific questions for Dr. Womack. I'm sorry, for Dr. Brumley.
Yes, thank you very much. Specifically, can you all hear me? Because it's now giving me an unstable internet connection. Okay. Specifically, in regards to the fact that this is the Juvenile Justice Reform Act Implementation Commission. When the reform was passed in 2003, and I know that was before your time, it set up a juvenile justice and education partnership, right? And so as such, we're extremely interested in the communication that is supposed to transpire between the educational system. So like the law was to establish greater communication, coordination, collaboration that needs to exist basically amongst the state, city, parish, and other local school systems with the juvenile justice agencies to address effectively issues affecting the behavior and discipline of students. So I would love to hear more about what Bessie is doing to ensure or look at working to revise the student discipline codes to remove more explicit zero tolerance mandates that ties the hands of the teachers, administrators, and school boards.
Yeah, so I think I think this is a good point or a good place to talk just a little bit about roles and responsibilities of local school systems versus the state board versus the legislature. And I appreciate you pointing out that work from 2003. For school systems across the state, they are essentially following statute in terms of how to deal with discipline laws. Now there are also other factors that are not discipline but are more positive approaches that aren't necessarily in statute but are things that systems are also trying to employ every day, such as we see things like positive behavior and intervention and supports, or conscious discipline or restorative circles and those types of things that aren't necessarily mandated in terms of statute. But, most of the administrators throughout the state, are working through statutes that have been passed by the legislators and then placed into their local policy. But, happy to hear your thoughts on if you want to provide any specific feedback on areas where you think we need to step in. Happy to hear that.
Thank you. Richard, I know you probably wasn't prepared in regards to the presentation that you shared at the Governor's Conference on Juvenile Justice and again at the Advisory Council, but you might have some something to say to Dr. Kate Brumley in regards to some of your findings.
We talked about a lot at the Governor's Conference, but some of our findings that I think are most interesting, at least to this body, I think would be that when we studied our data in the public defender system, we found that a rather high percentage of all delinquency cases in the public defender system came out of school settings. And I apologize, I don't have the numbers off the top of my head, but I want to say it was maybe a quarter or a third of all of those cases came out of a school setting, and that about half of those cases were either disturbing the peace or simple battery, very low misdemeanors. Whereas outside of the school setting, you had a much higher concentration of like felonies and major felonies. And in the school setting, you had very few of those, but you did have kind of an outsized amount of quantity of delinquency cases coming out of those, and that those cases were significantly more likely to be Black children than other cases were.
Richard, if I might ask, and if you have the information, did you see concentration within specific systems or districts, or did you see generally that was even across the entire state?
Well, we didn't actually look for that kind of concentration with that study, but one thing we have found, and I'm still trying to run down why this is, but in the most recent 6-month period that we looked at data, and this is just a regular look at data, this wasn't particular to schools, we found a very high concentration of disturbing the peace cases between July of 2020 and December 31st of 2020 in Caddo. Now, those used to be the single most common juvenile delinquency case we saw was disturbing the peace, and that has been in sharp decline recently in the last several years. But what we found was that disturbing the peace was the third most common charge in delinquency, which is way down from what it used to be, but that more than 1 of every 3 disturbing the peace delinquency case came out of Caddo Parish.
Yeah, the reason I asked the question,
I don't know why though.
Yeah, the reason I asked the question, I previously have served as a district superintendent in 2 systems, and in the first, we decided that we were going to, we were going to move away from out-of-school suspensions, and so in instances that would have qualified for an out-of-school suspension, we basically suspended to a district site that was a rehab and counseling type center for a specific amount of time. Those kids were able to maintain their attendance, they were able to maintain their assignments, and get the specific intervention and support that they might need to be successful. Stepping into a second system, we also began that work. And so the reason I'm asking the question is, I would tend to think, as you have already pointed out, that there may be some level of concentration into specific areas around those particular things. And I'd like to know that if it in fact is true.
I strongly suspect you are right, that things do vary a lot, not just from one jurisdiction to the next, but from one school to the next. Things may vary quite a bit. Unfortunately, I do not have the data in front of me to elaborate upon that, but I do suspect that is correct.
Thanks, Richard.
I don't want to take up all this space, so I'm gonna see if other folks have any additional questions before I continue. So in addition, we were definitely very interested on like how Bessie is ensuring that every school provides training for teachers that supports the positive interventions that's laid out in the legislation.
And does the legislation then charge Bessie with oversight?
Yes.
Okay. Yeah, I would have to take a look at that, because again, in most instances, the state legislature creates the law, and then local systems, and we have nearly 200 LEAs. They are then responsible for implementing those statutes, unless for some reason there's a space in which Bessie is supposed to promulgate some specific rule.
The legislation also like required Bessie to create a model master plan template and distribute it to all of the local school systems, and then get that information and then provide reports as such. And I know there's an advisory council on student discipline and behavior that's meeting, and we've discussed a couple of those issues. And if I can recall correctly, like some of the concern is really probably about manpower and whether or not we are supposed to collect the information on a yearly basis. And so like with that said, and I think if I'm understanding correctly with some of what you are saying, trying to figure out like what supports Bessie or LDOE might need to be able to acquire all the information necessary for us to be able to understand better, like what individual schools need to ensure that children are not unnecessarily being suspended and expelled from school, like we understand from some of our young people and parents, and the numbers of suspensions across the state every year. So I feel like as a commission, we're here to understand what is necessary from your perspective and how we can help ensure that we're doing our part to help you all do your part, so our young people are then not put in harm's way.
Yeah, again, I would share that you have multiple things happening there. So you have the state legislature, then you have local educational agencies, which are political subdivisions, and then you have Bessie, and then you have the Department of Education, which are two different institutions. And I can only speak for us as an agency. I can't speak for Bessie. So I mean, I can share with you, for us as an agency, we are committed to looking at anything within our power to keep more of our kids in a classroom. And I think one of the advantages that our particular administration has is that we have an outstanding staff that's very diverse in terms of gender, race, experience, philosophy. And the other side of that is that our staff has practitioner level experience, and we have been in these schools, and we have done these things, and we know some of the things that need to happen in order for those numbers of which you're concerned to decrease. And so if you want to send me anything specifically that you would like for me to explore, again, Gina, happy to do that. Happy to work with you. We are committed to doing better in this work. Our team is very committed to that and supporting systems. And so any insights you'd like to send me or share with me, I'd be happy to have that conversation.
Okay, yeah, that sounds great. I think we have some questions that we can follow up with you on so that we can gather a lot of the information. And it's true, like following the laws are, it's so cumbersome and complicated. And so I feel like we want to spend some time trying to figure out how the information comes from the legislation and gets down to the local levels, and how we can all work together to make sure that happens, that the laws are followed, and that our young people are being set up for success.
And Gina, I think that's a really good point around consistency. And I think that, some of the events that have transpired even over the last year have demonstrated that we don't necessarily have that level of consistency that many of us might like to see. And so I think that that's a really good point that you're raising.
So if it's okay with everyone, I can generate some questions and send around to the entire group commission to add or to vet, and then we can send them out to Dr. Brumley. Does that sound okay with folks?
Word. I have just a follow. Yes, I definitely support that, Gina. I have a follow-up question. It's probably for you, Gina, actually. The model master plan, is that specific to the issue around either in-school or out-of-school suspensions and or zero tolerance type of discipline? When you talk about the model master plan, is it specific to the issue of discipline?
Right, it's around school climate, which is encompassing of discipline and other things. And we may need to, well, I shouldn't say may, I know that we probably need to update the legislation so that it's clear that these plans should come from every school district on a yearly basis. And I can talk to you about that offline so we can kind of fix some of the missing information, if you will, that makes accountability very clear and the communication a lot clearer.
Right. Okay.
And there may be an opportunity too, Gina, where these are, statute for us to simply help communicate, in some areas where, for instance, staff training that's required and those types of things, that might be an opportunity for us to assist as well.
Right. Yeah, and which is one of the reasons I honestly really love the Juvenile Justice Reform Act of 2003. I think it was trying to consolidate and clear up some inconsistencies. But of course, many pieces have been repealed. And I just think it makes it harder to stay connected and follow what our true intentions are. Yep. So that was pretty much all I have. I mean, basically just, I think, to have a more extensive conversation and follow up with a lot of the questions and maybe even some individual meetings, just to make sure we can all get on the same page.
I have a follow-up question that may not be directly related to the last conversation, but it deals with the issue of trauma that children have experienced over the years, oftentimes just purely based upon the homes that they live in, the communities that they live in, the things they see to and from school. So, this notion of trauma-informed services and trauma-informed care is obviously not a new concept. But I'm curious to know, Dr. Brumley, since you have now been leading this department, what efforts can you speak to had already been in place in comparison to what is now in place under the new leadership? And now this is sort of a broad question. I realize this, right? Because I'm speaking in terms of just as a state, and I know local districts may take different approaches, but I'm asking the question more from the standpoint of kind of where we have been, where we are now, and where are we trying to go in terms of providing children with more trauma-informed care, and including the fact that our children have now been going through this pandemic for the past year. I know that I had some questions regarding funding, and Dr. Peterson was able to provide me with some additional answers regarding how dollars are broken down. But I think my question, outside of purely funding, has to do more with programmatic / training. How are we making this a focal point for dealing with this issue around trauma? Because I think the issues are very much related. the children that we see end up either in secure care or non-secure care have experienced something, or they're going to experience something that really needs to be treated in a special way. And you may need certain professionals or people who have certain professional training. What role is the Department of Education taking in trying to address these matters and not allowing these children to end up in secure care? Because that's the goal, I believe, we all should be working towards, is to try to keep our children out of secure care. So if you wouldn't mind speaking to that issue around trauma-informed care and where you see the department at this time.
Yeah, I had a conversation with a group of counselors, probably a year or two ago, and we were talking about students that were habitually not meeting expectation behaviorally, and I just asked the question, like, are there any common characteristics or traits among the children that you routinely work with? And one of the things, the thing that was shared across the board by those counselors is that for nearly every one of those children, they had experienced some form of trauma in their life. So for many of those students, if they were a newcomer to the country, it may have been their experience coming to America. It may have been an experience where they saw domestic violence. It may be a number where they were even abused. So that was the common factor in so much of that. And one of the things I think we have to do, and we will be pointing this out in terms of a best practice, is, we in state government or local governments will never be able to afford probably enough counselors and social workers that our kids need. And so one of the things that we can do, and this is one of the things I've previously done as a system level leader, is break down those barriers so that external providers can help assist us in those ways. I mean, and so that might be something physical where you get occupational or physical therapy assistance, or it might be something from a social emotional standpoint or a behavioral standpoint. And so I think one of the things that could be really important as we move into the future is not thinking of the school in terms of having to solve it alone, but having a school be a place where different supports are available, not just from school system employees, but from external providers as well, where those individuals can even be officed there. And this might look like billing of private insurance, but for the most part in Louisiana, where over 70% of our students come from economically disadvantaged homes, it's going to be Medicaid billing. And so we have an opportunity there. We also need to explore the pandemics, or continue to explore the pandemics impact on students, because we did some surveying, we did some focus group activities in the fall of the year around the state's response and how kids and staff were doing. And one of the patterns that we heard is just concerns around mental health and behavioral health. And look, that wasn't just kids, that was teachers too. And so I do want to pull in Dr. Peterson just for a moment to share out one of the initiatives that we're working through right now around mental health, specifically with some of the educators across the state.
Yeah, so we have put out through competitive process and ended up working with Oshner and Amwell. And so we're really excited to be working with them on the development of a mental health support for our educators. We'll be giving access to our educators mental health support, so therapists that is going to span, not just the regular hours, but really making sure that they're connected even outside of that and the weekend, and specifically creating that funding source from us to ensure that our educators that are either not insured or underinsured have access to that, as well as through an app. And so telehealth services, so that they actually are able to do that, because we know it's important too for our educators mental health supports to be maintained in order to be able to service their students. So that's one component that we're doing in that space. I would say the other component too, as we talk about the school social workers and expanding that, this all becomes like interrelated with our mental health supports and trauma-informed care, is also rethinking how we use our school social workers. And so we currently work with LSU, their school social work department, and making sure that we are able to provide additional assistance. We have 12 high need systems right now that we're working with to provide a school social worker in those systems. We're looking at continuing that program, but also pivoting to make sure that we also think about this, not only just for the mental health supports, but also the way that we think about like the root cause analysis for some of our discipline behaviors, right? So instead of doing an out of school suspension, let's really get at what the root cause is and utilizing the school social worker. And so in addition to providing the professional development pieces that we often do, it's also how do we build capacity within the system, within the school? And we can do that through our partnership with LSU by providing the school social workers as an avenue to hold groups and to actually work with the student individually, so that that's an option outside of just out of school suspension.
Representative Duplessis, one other thing that Dr. Peterson reminded me of is, you know, we have a listing of schools essentially that are on a listing that we have for intervention because of the rate of their discipline referrals and suspensions. And so those schools are taking part in our social emotional learning and academic integration pilot that we're basically running. And so it's an SEL academy, and it's helping train educators and leaders in those schools, you know, on things like understanding emotions, setting goals, showing empathy, establishing positive relationships, and making responsible decisions. And so we're excited to see how that is working with, you know, several dozen schools that are essentially in that pilot, and what lessons we might learn from that. And whenever we talk about funding, heard you talk a little bit about funding, you know, I think there's an opportunity too, and you know, this is an allowable expense with some of the stimulus dollars that we have coming in from the federal government. While the overwhelming majority of that flows right into the systems and is not held at the state agency, systems can use those funds for social workers and counselors because of the impact that mental health is making in terms of, or rather, the impact of the pandemic on mental health.
Thank you. The last point that I'll make, I don't know if it's a question or a comment, but maybe more of a suggestion. If policies like this are not already in place, it's my hope that perhaps the department and Bessie can look at this. Would be, you know, there are instances where teachers and administrators have knowledge about what a child may have experienced or may be experiencing, and what policies we have in place, or what opportunities there are for there to be some sort of intervention before it's too late, right? And I know y'all kind of touched on it a little bit, but you know, just something as simple as when a child, I've been trying to learn more about this, but when a child has like an incarcerated parent, or they witness a parent being taken off to jail, or they witness something in their neighborhood, somebody gets shot, and the school becomes aware of that, what are we doing to make sure that we can try to, as you mentioned, break down some of the barriers to get to those children before they start acting out, and we're not responding after discipline is being taken, but we know that some sort of adverse, they've had some type of adverse experience. What can we do to try to intervene in a way that's constructive? Now, again, that's less of a question and more just like a suggestion that there may be things already taking place, but I think that's something that I would hope that Bessie and the Department of Ed is working on trying to improve.
Yeah, and look, I had this conversation with Dr. Leger yesterday, and I mean, Dr. Leger, myself, Dr. Peterson, all of us served as school administrators, and so much of this was just about administrators at the school level understanding the value and being able to have like authentic relationships with students and teachers and parents, that you understand where kids are coming from, and you understand where their parents or lack thereof might be coming from or not. and know how to respond to that. And so, I think there's also opportunities for additional training. And that's why whenever Gina was discussing, I thought she made a really good point earlier about our ability to communicate and also support the idea around additional training for people, which is what our social emotional learning and academics integration work is doing in many ways.
Thank you.
Yeah, and can I just add a couple of things in regard, because the previous conversation just really made me think about one thing from our perspective, Flick's perspective. We've been talking about like the community school model, right? And it sounds like a lot of what was said prior really could fit in that model. So it'll be great to open that up as a conversation. And in addition, in regards to the training, and I know another thing we've constantly pushed for is to ensure that we have adequately trained teachers, that teachers have gone through to make sure that they understand adolescent brain development. So, having high quality teachers is also very important, and that we can ensure young people are being thought about correctly in a way that is age appropriate, and that correction for behaviors and stuff like that is age appropriate. In addition, training should be happening on a regular basis. And I know when there was the model to use the positive behavior interventions, that was something that was being utilized through the school systems. I'm not quite sure where that is. And that just really talks about, children are not problems, they have problems, and it recognizes all of the things that we've been discussing. So it'd be great to hear more about the restorative practices and the positive behavior supports that should be utilized. And are we still using those techniques? I remember years ago, it was very popular. We were definitely moving in a direction. However, what was really key to utilizing positive behavior support was also including families in that, and there was money for it, but that wasn't actually happening. So, this is also kind of a JJREIC question for us as to, we're tasked with a lot to help oversee and to coordinate the budgets, children's budgets and such. And so maybe we can think about setting up committees so that we can make sure we are working on and with the various stakeholders to make sure we're tackling these issues from the local levels all the way up to the state level. So we'll have accountability and better communication.
Does anyone else have any questions for Dr. Brumley or his team with the Department of Ed?
Representative, if I may, I'm never going to miss an opportunity to talk about, I know it's not directly related, but it certainly is indirectly. Right now in our state, we only have 4 out of 10 kids coming to kindergarten on day one with the skills they need to be successful on day one. And whenever we look in our impoverished communities or into some of our subgroups, those numbers are even more alarming. And until, in my opinion, until we invest in quantity of seats, but also quality seats in early childhood, we're not going to see the shift and the transformation that we want to see as a state. And we have to have investment there. Because right now, only 46% of kids, by the time they leave 3rd grade, are like mastering reading content. They're 2 or 3 times more likely to drop out than their peers, and then people point a finger at the educational system at the flaws, and I just think that we have to make an investment earlier on when, the child's brain has not been fully developed. And we know that by the time the kid's 5 years old, 90% of brain development has already happened. So I just wanted to mention that. And I also wanted to mention the fact that any supports that we can get to not only deepen the teaching profession in terms of quantity, but right now across our state, and I made this comment on a radio show this morning, there's a 60% chance that if you're a student in the state of Louisiana, your teacher is a white female. And so we want to make sure that we have more teachers of every demographic, but there's only a 5% chance that your teacher is an African American male. And we know the impact of an African American male teacher, specifically on Black boys between 3rd and 8th grade. But we also know that that's good for boys of every color. And so any support and work that we can get around that or those two issues would be helpful, because while they're not directly related, I think they certainly play a part in some of the challenges that we're facing.
I would agree 100%. I'm sorry with that. And I think, that is also something that we can tackle better with community schools. And because there are probably organizations that are looking at some of those issues in regards to finding more African American males. I know locally here in New Orleans, there's a group called Brothers Empowered to Teach. We'd have to do, just more research on seeing where these other models may exist. And if they don't exist across the state, then working with the folks that are already in place, right? And that takes coordination. And again, our organization, our families, our young people have been talking about community schools for a very long time, and having a holistic approach, identifying what some of the issues are, just what you mentioned, Dr. Brumley, because I think that is definitely crucial, but those things have to come from the local level. So we'll know exactly what we need and how to solve those problems, and then bring that upwards to the state level. I'm sorry, Representative Duplessis.
No. Thank you, Gina. Thank you for everything you just said. And thank you, Dr. Brumley. You have my full commitment to support your efforts in terms of investing more in that early childhood development, the quality seats. I believe that early childhood development is economic development. It's less we have to invest in doing the work that we're doing right now around juvenile justice. And I mean, there's just no question. The science is there, the data is there. So you absolutely have my full commitment. And I want to thank you again for always making that a priority. I know when you first took the job, that has always been at the top of your list. So just know that I share that commitment with you and stand ready to support you in that effort.
Yeah, Rep, I would share here, with some of the stimulus dollars that we're going to receive, we're going to pump that in the ways that we can, expanding access for that birth to 3 space. Mm-hmm. But we're only going to be able to create a bridge. So, our funding's only going to be good for so long, and we really have to think a couple of years out. If we can use funding to create a bridge, that's all it is. And at some point, we're going to be walking off that bridge, and what is sustainable and in place to make sure that we can keep this moving forward is really, really important. And our office will be here to support that.
Thank you. Thank you so much for your leadership. Does anyone else have any questions for Dr. Brumley before we move on to the next presenter? Well, I know that Ms. Womack is going to be following up with some questions for Dr. Brumley and his team, and we look forward to continuing that discussion. Thank you, Dr. Brumley and Dr. Peterson and Dr. Leger for y'all's participation today, and we look forward to working with y'all going forward. Next, we will ask Dr. Dana Hunter. I saw her on, she's moved, her square moved. Dr. Dana Hunter with the Children's Cabinet will provide us with an update and presentation on some of the great work that they've been doing. So Dr. Hunter, thank you for taking time out of your day to be with us. Thank you.
Yes, sir. Thank you, Representative, for having me, and Dr. Nagatu, Gina, and the members of the commission. Thank you all so very much. All right, so I'll just dive in, and many of you guys know that the Children's Cabinet is a shop of one, but we make it like it's a shop of 10, right? Because we like to make sure that every every issue is addressed in the best way possible. And we know that we have many issues across systems, across youth, juveniles, families, and just numerous issues. And so our role at the Children's Cabinet is to make sure policies, programs, services, that there's a coordination and an alignment of services, and that resources are being leveraged and used the best way possible across systems and across the state. And so we work very closely with each member of the Children's Cabinet, a 13-member network, along with the leadership of the Governor and First Lady, who sits and serves as honorary co-chairs of the cabinet. And then we work with our Children's Cabinet Advisory Board, a 40-member network of service providers who largely work in subcommittees. And so I will just kind of go way back and say for the last, actually when I started in 2017, the Governor and First Lady had just attended a NGA conference, National Governors Association meeting, where each state was presented with a state-specific overview of childhood hunger and what childhood hunger looked like in their state. And the numbers of children and youth experiencing childhood hunger here in Louisiana was just astounding. And so I'd only been on the job for maybe a month or 3 weeks at that time, and then got an email from the governor which said he wanted the Children's Cabinet to address childhood hunger. And so right away, I pulled in key stakeholders, DOE, and other key members of the cabinet, and we looked at a state-specific plan. We actually wrote a grant to NGA and Share Our Strength to apply for a grant to help get technical assistance to address childhood hunger. We were one of 8 states awarded that grant in May of 2017, and we jumped on it right away. We took Senator Barrow joined us, and we had a team of 5 that went to Virginia to work closely with their governor then at the time, and First Lady, and other experts in the area of childhood hunger. So we developed that state-specific plan to address childhood hunger. We implemented it in July of 2017. In September of 2017, we launched No Kid Hungry, which was largely led by the Governor and First Lady and our state-specific team. The goals of No Kid Hungry were to, one, of course, launch the implementation of that state-specific plan, which included goals of getting our state to 100% participation in community eligibility, which was a rule passed by the federal government, which said that all kids could eat for free regardless of applications, completing that long, lengthy application that sometimes parents filled out, sometimes parents didn't. Regardless of that, children could eat for free. Those places that were eligible to adopt community eligibility, we wanted to work with them and provide them with technical assistance to make sure they adopted it. We had a smaller percent of schools that had done it. By the time we ended up working with them, we got to 98% of schools in our state that had actually adopted CEP, giving those children access. Our goal was to increase school breakfast participation among schools, to get children to eat those meals that were eligible to them at no cost. We also wanted to focus on the Delta region, those areas in North Louisiana along those Delta parishes where we know there were high concentration and high numbers of childhood poverty and childhood hunger. And so Morehouse, Ouachita, West Carroll, East Carroll, Tensas, all along that line, we really focused in and worked with DOE and our Share Our Strength partners to really focus on increasing food access in those areas. And then lastly, we wanted to make sure that children and kids had access to food in after school time, which USDA provided access to those meals at no cost to children. But when we first started, there were very few schools and children that were taking advantage of those meals. So we strategically looked at how can we get children to take advantage of these meals? How can we get schools to implement programs or to utilize services or whatever have you to make sure that kids have access to these after school meals. And then the last one was summer meals. We recognize that USDA had provisions for schools, entities, faith-based organizations, you name it, to take advantage of resources and food feeding programs that they had available. However, folks didn't know, in some places, entities did not know about it. And so we did a big push to increase the number of entities that would offer summer meals to children, of course, at no cost to the students. And we saw great participation. In just 2 years of really implementing that state plan, we saw an increase of over 1 million plus meals. And we just saw an increase of sponsors for the summer food programs, an increase of the number of schools that offered after school meals. There were some athletic programs that didn't know that they could offer meals and give meals to their athletes, all of those things. So we really worked to try and find those creative ways and creative, innovative strategies to increase children's access to meals. We even implemented school breakfast challenges and worked with the Dairy Alliance and Share Our Strength to offer $1,000 cash prizes to different schools. I want to say parades, what we call it, Drew Brees. All of those incentives were offered to schools who increased meals the most during a specific month that we offered that challenge. So all of those things really proved to help. Also, another huge initiative that we've been working on over the last few years have been human trafficking. And I'm sure many of the members, commission members have heard a lot of this, have heard me present on this. And so since September 2017, we launched a symposium. We held a symposium to really give some baseline information on the fact that human trafficking, the number of children, youth, and even adults being kidnapped, raped, all of those things, held, forced fraud, or coerced into these unhealthy relationships. We wanted to let folks know that this was real, this was happening right here in our state. And so we really just hit the ground running in launching that, having that symposium. We applied for funding through the National Criminal Justice Training Center to bring in key partners and to go across the state and to really reach out to key providers in areas of the state to say, what do you need? Do you know that this is real? We brought in law enforcement, you name it. And then we really wanted to have conversations about what supports do you need to improve services to victims of human trafficking, to increase awareness for educators, providers, you name it. And so we went across the state. We had over 700 key service providers to participate in just a 6-month time frame, which was very significant. And then right towards the end of those summits, we applied to the U.S. Department of Justice, the U.S. Department of Justice Office for Victims of Crime, for an Improving Outcomes grant for child and youth victims of human trafficking. And Louisiana in 2018 was the only state in the country to receive this award to really address human trafficking and to improve outcomes for victims of human trafficking, child and youth victims of human trafficking. And so we launched that initiative in January of 2019. We hired eight regional coordinators across the state to serve as key contacts, key professionals or experts in their specific region that could be a source for law enforcement, that could be a resource for any service provider in that area, just to create a network of key individuals, key partners in the area. And so that has proven it's a best practice across the country. We use over $900,000 of that funding for those coordinators. And in just probably right when they got started, COVID hit. But however, they found innovative ways to continue to get training, to continue to do what we put them in place to do. And in just 3 to 5 months, they were saturated in training and they hit the ground running in bringing in those key partners. Collaboration is the biggest part. The name of the initiative is the Louisiana Child and Youth Trafficking Collaborative. We stress that word collaboration. And so their role is outreach and collaboration, screening, training, and advocacy. And so they work closely with their CAC partners all over the state, DCFS, law enforcement, you name it, to make sure that we're closing in the gap. We're creating multidisciplinary teams across the state, again, to really look at the needs of victims, these vulnerable group of victims. And so that initiative has been a huge piece for the Children's Cabinet as well. Outside of that, again, our Children's Cabinet Advisory Board over the last several years have worked within subcommittees to address multiple issues. And I'll just kind of highlight some of those issues that the Children's Cabinet Advisory Board has worked on and provided advocacy and support for over the last several years. One of the issues has been, of course, as Dr. Brumley just mentioned, support for early intervention, early literacy, and early childcare, early childhood education. We all know that, you guys just had the conversation about the importance of early intervention. And so one of our subcommittees, we actually expanded to solely focus on early literacy and early childhood education. And so that committee over the last several years have looked at efforts to improve reading, to improve literacy, to create those services to support funding for early childhood. I want to say, let me go to my notes. And I want to say it was last year before last maybe, through the advocacy and support of one of the subcommittees, the governor, and we saw over $20 million passed for early childhood education. So that was largely, of course, advocates from all over, but the support from the Children's Cabinet Advisory Board and the subcommittee was key as well. The task force, so we work closely, of course, with DCFS, Youth Aging Out of Foster Care. We supported that legislation. I spent years working at DCFS, and so I knew the importance. Other subcommittee members knew the importance. We've provided support to DCFS over the last several years for funding for their case managers. We know that under the Jindal administration, DCFS's budget was sliced, and that directly impacted their ability to fund case managers who provide those direct services. And so bringing back that funding and support was paramount, and our CCAB subcommittee offered recommendations to the Children's Cabinet to increase funding for caseworkers. We provided support for Raise the Age. Of course, you guys know Raise the Age went into effect March 1st. And so my office convened meetings for the Raise the Age Commission. We serve to support JDAI, which one of the mandates or efforts that JDI has been working on has been to implement a objective screening tool, which the screening tool, the DSI or the RAY, it causes legal professionals to look at whether or not a juvenile should be detained or not. And so that's paramount, because we know that large numbers of African-American youth were being detained who may not have needed to be detained. And so implementation of this tool was key as well. So I could go on and on of other supports, but I'll just say, I know that you guys mentioned mental health, and I'll say that we've most recently, we've been working with and supporting the Department of Education and the Department of Health in a new initiative that they have going on, Project Aware, which increases the number of mental health professionals in schools K through 12, which also provides a network of mental health providers to identify and address potential mental health needs. And I wasn't sure if that was the program that Dr. Peterson was referencing, but I've been working with Daryl Montgomery at the Office of Behavioral Health to really support and to give outreach for this initiative. And I'll just name a few others. or I can stop there. Y'all tell me.
It's totally up to you, Dr. Hunt. This is your. It's totally
I'll just name two more that I think y'all will probably want to hear. So our policy team, I've been working with our policy team to support an initiative, actually to support legislation that Senator Barrow offered last year, but it was pulled due to COVID. Is SB 128. And SB 128, it requires certain assessments and screenings for children in schools that are being recommended for suspension. So instead of suspending these children, these students, school personnel would have to give them a screening for ACEs and to assess for trauma. And so that's a bill that is we're advocating for now to come back through session, this legislative session. I need to get an update from our policy team on where things stand with that. But we support this kind of bill and legislation because we know that large numbers of children and students are suspended who their number of ACEs, if we looked at it, are potentially out the roof. You know, we know that these kids are experiencing domestic violence in their homes. They're living in neighborhoods where there's high crime and violence and experiencing childhood hunger. As we travel the state, you will be surprised at the number of children who say, I eat at school because there's no such thing as eating at home. I live with my grandmother and food is scarce. I remember working with a juvenile who was in high school, and I actually visited his home. And when I visited his home, there was literally no food in the home. And so thankfully I picked him up something from Popeyes before we got to this kid's home. But to see that a high school kid was living in a trailer with no food, it had running water, but the living conditions were just deplorable. But kids are in these kinds of situations and circumstances and are being, and they have to learn, they have to go on. And so we never know how the situations and the trauma and that they're experiencing will play out in school. And so an assessment like this is something that we think is important to support. And so we're looking forward to this bill coming back to the legislature this session. And then other recommendations that our advisory board has made to the cabinet includes support for a perinatal consultation program statewide, which would allow for physicians and other health professionals to screen families early on to see what their needs are, not just mental health, but what are some of those specific needs that this family need, that this child may need prior to the child being born. And so that they can perhaps provide some wraparound services to parents prior to children coming into being born. And so that's one recommendation, trying to assess and address ACEs early on. And then allocating money for universal health documentation was another recommendation. So I'll just stop there, and as you ask questions, I may introduce other items that the Children's Cabinet have been working on, but I'll just stop there and take questions.
Thank you, Dr. Hunter. We really appreciate that presentation. And thank you for the work that you do in general. You cover a robust portfolio of issues when you talk about the well-being of children and the well-being of families. The issues run the gamut, as your presentation has pointed out to this commission. And I'm particularly interested in the policy advocacy around the ACEs screening. And that ties directly into a question that I have for Dr. Brumley. How do we get in through data, evidence-based approaches to try to understand what these children are experiencing, to try to intervene with services prior to them becoming system involved? So that's something that I have particular interest in. I'll be reaching out to Senator Barrow to offer whatever support I can on that. And I think I just want to point out and give other commission members an opportunity to ask questions if they have any. The difficulty of I think a job that you have in that what I see is that you're trying to bring a lot of different pieces together. And oftentimes in government, we work in silos. So the issue in terms of solving the challenges around juvenile justice, we can't solve them unless we're dealing with issues around the well-being of the child, and the way that and the work that you're doing. So it won't be solved just by dealing with Deputy Secretary Summers and OJJ. We have to work with all of the stakeholders on the front end, and education leaders and everybody else to try to deal with the issue around juvenile justice. And one of the biggest challenges that I have found in this role is just trying to bring all of those interests together. It is a very difficult challenge. So I just want to thank you for the work that you're doing. And I'm particularly interested in the work around the ACEs assessment. So with that, I will be quiet and ask if anyone else has any questions for Dr. Hunter and the work that she's doing.
Thank you, Representative.
Yeah,
And the
thank you.
Louisiana Center for Health Equity is the organization that we've been working closely with to push that bill. So they've been working directly with Senator Barrow on that bill. And I can give you their information as well.
Thank you, Dr. Hunter and Representative Duplessis, and I agree. You know, as a member of the Children's Cabinet Advisory Board, I watch, participate in many of those meetings and watch you work really, really hard, as well as all the stakeholders at the table to work diligently to, as Representative Duplessis just stated, try to lift these mountains and do such hard work. And the folks are very, very dedicated, and we really, really appreciate that. And even given all of the great work that you're doing, like I've seen several reports, probably two, that Louisiana is the worst state in the country for children, right? And so in our work, we're gonna always ask, like, how are our children doing, and are we setting them up for success? And how do we do that? And it is a huge task, right? Even while all the folks are running around trying to figure out, and all the wonderful work that has happened regarding hunger, our young people are still hungry across the state, which is, and the challenge is great. And so for me, what I've often have talked about in regards, and I'm always saying Juvenile Justice Reform Act 1225, and even before I knew, it was like all pulled apart and we were back in silos, because the beauty of the law and the legislation was about coming together and coordinating the care and the systems of care, so that each of the systems weren't in their spaces trying to do the heavy lift. And then we're constantly calling OJJ about, like, why are you locking up all these kids when, and doing their part. So in regards to the reform and the Children's Cabinet, what I would really love to hear about is the place where the Children's Cabinet should facilitate the creation of the Children, Youth, and Planning Boards. And I know from the Children's Cabinet perspective, Advisory Board, we've talked a little bit about it, but even listening to all of the wonderful things that you're saying that has happened, we're still finding ourselves where our young people are at the bottom of educational opportunities. They're at the bottom of well-being, right? And how we can do a much better job to coordinate the services. And so from my perspective and what I understand, the Children, Youth, and Planning Boards would be a great tool to utilize. And so the Children's Cabinet is charged with offering guidance and technical assistance to the local community and governing authorities, included but not limited to resource identification, needs assessments, monitoring and performance evaluations, strategic planning, and other forms of assistance. What I love about the Children's Cabinet, the Children, Youth, and Planning Boards are that they have all the local child, they like baby children's cabinets. They have all the local child serving entities at the table: the public defenders, district attorney, the school systems, the police, mental health, all the folks that can talk about what's happening locally. If we could figure out how to make those boards work according to legislation, I think we would find ourselves in a much better situation. Because if you're at the state level and you're trying to do and work on homeless and hunger and education from that perspective, you're not understanding what each local community needs. So, so I'm asking and hoping that as the commission, we could provide more supports to align and to ensure that every jurisdiction has a local children, youth, and planning board, that each of those boards actually follow their mandate, that we operate through, that we're data driven, right? That we are coming to the table with information so that we'll know and be able, I believe, to make a much more rigorous children's budget. Not, in understanding, because New Orleans may need more mental health services and a rural community may need more help with hunger or different things like that. And so, of course, we may not have all the money that's necessary to provide support, but we should definitely try to get to that point and prioritize our young people. And I think that we wouldn't have many of the issues that we've been talking about if we could coordinate those services. So just kind of wanted to hear from you, like, what can we do as a commission to provide you with support? I remember I set up the children, youth, and planning boards and calling the jurisdictions, and they were like, oh, what? And it's an unfunded mandate. So those are things that we probably need to be able to discuss here as a commission, and probably then with the governor, so that we're looking at being able to utilize these tools of accountability and support to actually work for our young people.
Well, Gina, you said a mouthful, and I think you answered. I think you answered your own question. But you're absolutely right. So the Children and Youth Planning Boards were established to provide those local identification, assessment of needs for really children. But with that, when the law first passed, I want to say they received a grant to fund and to help start up these Children and Youth Planning Boards. Of course, when the funding went away, those Children and Youth Planning Boards that were in place continued for a minute, and then without funding, several of them, could no longer function. And so when we started, the Children's Cabinet began to do outreach to try and hold meetings, and truly there were only 1 or 2 Children and Youth Planning Boards that were active and that would participate. And so we kind of last year, we did some outreach. We did like a survey and an assessment to the existing Children and Youth Planning Boards to see, what are you doing? What are you doing that has caused your Children and Youth Planning Board to work, to last? How have you stayed in place when so many others have been dismantled? And the key was, we have dedicated staff, we have an executive director, we have those supports in place of folks who can bring the key players together and to keep the mission of the Children and Youth Planning Board moving. And we quickly found from the assessments and the surveys that we sent out that those areas that have funding were working well. Those areas where there was no funding, those were the areas where they were like, hey, we would do this, but we just don't have capacity. And so if this group could develop a plan to fund, to present to the legislature or the governor's office, a plan to help fund these Children and Youth Planning Boards, I think it would be helpful, because across jurisdictions, we heard, in some places the desire to do it, but just the willpower and the capacity to do it was not there. And so.
Right. And that's truly the sad and frustrating point, right? That the will wasn't there, because it's the irony of this is that we can't find the money to support the Children, Youth, and Planning Boards. These are, should be effective tools to support our young people, but we can find money to build a prison. And that is counterproductive, right? Like we can, do all of those things on the back end, but our children need our commitment and to make them a priority so that we are setting them up for success, right? And so, yes, I agree, and I challenge our commission to really work to figure out and put together a plan, but I also challenge the children's cabinet, right? Because to be able to find the methodology to also support and get a understanding, and if and provide some uniformity for the Children, Youth, and Planning Board. And if we're hearing from many of the children, the CYPBs, and that's what they need is money, then those are maybe the recommendations we should be making from the Children's Cabinet perspective, that, hey, we have these groups that should be operating in the way so that we can understand what our recommendations to the governor are, so we can provide a coordinated and a better children's budget. So I would love to see that we all have take our accountability and do more to make these policies work in behalf of our young people. Our Children, Youth, and Planning Board in New Orleans has sought funding from grants. So there are creative ways. If that's, I'm still not sure how the money through the OJJDP is working, but there should be funds that's available so that, and I just find that we went back to working into silos, and we put bunches of money in pilot projects to see if they're going to work, when there are existing programs that actually do work, that we should be putting, redirecting those funds so that the programs are actually working, are growing, and then they work some more, opposed to trying something new. Raising and rearing and supporting children, there's nothing new about that, right? Like, children need caring adults that understand adolescent brain development, that love and support them, that want to take, that recognize that they are not problems, they are problems, they're young people, they're children, that they're not stuck in this, under this definition of juveniles that has such a negative connotation, and automatically, starts to track these young people into a system that they shouldn't be in. And so I'm gonna just stop there and just challenge us as a commission, and as the Children's Cabinet, that we maybe look at our priorities and restructure some things that will be more supportive.
The Vulnerable Youth Subcommittee, they had a lot of discussion around the Children and Youth Planning Board. So you may want to maybe at the next meeting, either email the co-chairs or, just let them know that this is still something. I don't know if you sit on that.
I'm on that committee, and I've talked ad nauseum about the Children, Youth, and Planning Board. So, so that's why I'm bringing it here to the commission, so that we could really understand and look at what the Juvenile Justice Reform Act was meant, what the intentions were, and look at some of the historical information as to what were the pros and cons, and then sort of move from that perspective to try to do more to fulfill this law that was all around consolidating and coordinating systems of care. So thank you, Dana.
Thank you. Does anyone else have any questions for Dr. Hunter? All right, Dr. Hunter, we look forward to continuing to support your efforts, and we want this commission to serve as a resource for what you are already doing. And we look forward to continuing to try to serve our children and serve our youth and serve our families collectively. So again, thank you so very much. And I'll be circling back with you, particularly on the piece that I mentioned earlier around Senator Barrow's legislation. I think that is that's something we need to move forward on.
Yes, sir. Thank you all. Thank you, and thank you for your leadership.
Thank you for spending time with us today.
Yes, sir. All
right. Next, the last two pieces that I'd like to cover today. We have someone who reached out and wanted to share some perspective with the commission, Ms. Robin Simmons. I'm going to give Ms. Simmons an opportunity to speak to the commission. And then we also have Mr. Bill Summers, who was gracious enough to join us today. I don't know if the commission wants to follow up with any questions from the last meeting, or if he has anything that he'd like to speak to, but I just want to give him that opportunity as we turn the corner on this meeting. But Ms. Simmons has some personal testimony that she would like to share, and also work with us to try to advocate for some policy changes that we need at the state level to protect our children who are in secure care. So Ms. Simmons, you can go ahead on and share with us whatever you'd like to share.
Okay, thank you so much. Thank you for the opportunity to come before y'all today and share our family story. Our family is trying to see that we ban solitary confinement in juvenile centers across the state of Louisiana. I'm the adopted grandmother of Solon Peterson, and I'm just going to quickly, I don't know if y'all can see him or not, but that's me and Solon. Solon was in foster care from the age of 6 months to 6 years of age. During these formative years, he was back and forth from with his mother to family members to various foster homes, 10 homes total. He was finally placed in my children's home August 12th, 2012, where he was eventually adopted. During the first 6 years of his life, he was abused, neglected, and traumatized by the events that occurred in his young life. As he settled in with my kids, my daughter and son-in-law, he experienced ADHD along with anxiety, and along with the typical children behaviors that things that kids do. He also, once he settled in, he was also diagnosed with PTSD and ODD, which is oppositional defiant disorder. He was placed on medication for these mental issues, and he was also seeing a behavioral therapist. Solon was a very bright and creative child. He was very a happy boy with an infectious smile. He never met a stranger, and he was always making people laugh. He loved to fish, he loved to wakeboard, but most of all, he was loved being a goalie on the Shreveport Mudbugs youth team here in Shreveport. He wanted to be a professional goalie. Solon turned 13 on January 20th, 2019. February 1st came along, and he decided that for some reason he would set fire to the trash can in the boys' restroom at Houghton Middle School. My children were called to the school to address the issue, and while they were on the way to the school, they spoke with their pediatrician who had just put him on medication for ODD, and thinking that may have triggered his outburst, or his outburst or whatever. They wanted to be able to put him in the hospital or Brentwood to be able to adjust his medication. When they got to the school, they were speaking with the judge at the time, and their request to take him to the hospital was denied. At that point in time, he was sent to the Ware Detention Center in Coshada, Louisiana, which is about a mile from our home. And he appeared, this happened on Friday, February 1st, around 2:30 in the afternoon. Monday, he went to court, and he was not released to his parents. And he was sent back to the detention center with regards of him to have a thorough assessment of his mental state and all this. This was his first offense. During his time of being incarcerated, he was held in a regular cell up until February 5th. At which time in his regular cell, he decided to take a piece of wire or something out of a lamp, and he managed to pick the lock on his cell. He just didn't like being caged in and couldn't grasp everything. But anyway, the guards and the staff wasn't able to, didn't know how to handle him or what to do with him, so they decided to stick him in solitary confinement. My children went Tuesday the 5th to visit with him and was not told he was in solitary confinement. So my kids were able to visit with Solon through a glass window and the little opening in the door, and was not able to have a physical visit with him. The guards and the staff assured my children that Solon would be released that night or early in the morning, because if during the night, if he was sleeping, they would not disturb him for him to be, to move him out. That never happened. February 9th, about 11:30 p.m., Solon took his life while being in solitary confinement. When my children visited with him, what they saw was this broken little boy who was depressed. He also had bruises on his knuckles from hitting the walls there while he was in his cell. And they kept trying to tell him, to do what you're told, obey, and we're doing everything we can to get you out. When you're in solitary confinement, it's our understanding that you're to be checked on every 15 minutes, because that's about the time that you can take your life and not survive. In this case, Solon wasn't checked on for 2 hours, which allowed him the opportunity to end his life. Again, he was neglected and abandoned by those who oversaw him. Solon, this was his first offense and should have never been incarcerated. Solon never got the assessment for the reasons we don't know. Rachel Gasser with Louisiana Children for Center Rights and Representative Melinda White presented to the legislature House Bill 158. This bill requires a thorough assessment for a child to see if there are other alternatives other than incarceration. House Bill 158 became Solon's law in June of 2019 after being signed by Governor John Bel Edwards. At that time, former Senator Ryan Gaddy proposed SR 133. It was to study solitary confinement, the effects it has on children, and banning the practice of solitary confinement. At this time, that resolution has since expired. It's my opinion and opinion of my children that children do not belong in solitary confinement for any reason at all. This practice is cruel and unjust punishment, even though they might be there for their protection. Adults have issues being in solitary confinement. So just think how these young people are trying to cope on a daily basis and they cannot. And if they do survive it, then they may incur long-term effects as they go into adulthood. It's also our opinion that children who are in these facilities have been traumatized in one way or other, and listening to everybody speak, we all understand that children, even if in a two-parent home, it's not always perfect, but a lot of these kids come from traumatized backgrounds, and it's just, in putting him in solitary confinement, it's just way too much. Solon was remorseful for what he did, and he knew that he was going to have to make amends to what he had done for the damage that he had caused. the trauma that these kids deal with on a daily basis, when they're put in solitary confinement, they have to deal with depression, anger, hopelessness, self-harm, and in Sola's case, suicide. I could go on with the list of the harsh effects, but I don't think I need to. And I came here today hoping that you would take a look at this and consider it if it was your child or your grandchild. And we ask that you help us proceed in banning solitary confinement so that another family doesn't have to, that another child doesn't have to lose hope and think ending their life is the only way out. And if we don't take the necessary steps to help our children, then who will? And I appreciate this opportunity to share our story, and that you would look into the possibility of moving forward with the banning of solitary confinement in our juvenile detention centers.
Thank you so much, Ms. Simmons. I think I speak for the entire commission when I say that our hearts break for you and your family, for what you all have, the loss that you all have suffered. So I just want to express that to you.
Thank you.
And just know that that we share in your grief, although we may not be able to fully understand or appreciate because we are not in that scenario with you. Know that we feel your pain and we share in it, because no family should have to go through that.
Exactly.
No one. So on that note, I want to just thank you for being willing to share your testimony and choosing to take your experience to try to prevent this from happening again. Because I believe that this type of situation is preventable. Mm-hmm. And I believe that no child should be in a situation where they're in secure care by the state. Exactly. And they should be able to inflict this type of harm on themselves. Now, this is a conversation that we're certainly going to be engaged in. Before we talk a little bit about where we are from a policy standpoint, I want to give Rachel Gassert an opportunity to share some perspective on where we are right now legislatively on this issue. I know that there have been groups and coalitions that have been working around the issue of solitary confinement, not only as it relates to juveniles, but other detainees as well. I've always believed that it is an inhumane practice. That's my personal belief. But I think it's something that we need to take a serious look at how we can prevent situations like that from ever occurring. So I'm going to ask Ms. Gassert if you could please provide some additional context around legislative efforts that have taken place most recently and where we are now as a state from a policy standpoint.
Thank you, Representative Chairman Duplessis. I'm Rachel Gassert. I'm the policy director for the Louisiana Center for Children's Rights, and I've known Ms. Simmons and the family and heard this, and I've known this story for 2 years now, and it never gets easier to hear that story and to think about what Solon and the family have went through. My heart breaks as well, hearing it again. There's good news and there's bad news on this issue. The good news is that when it comes to juvenile policy on solitary confinement, we are in a better place in Louisiana than we are when it comes to adult solitary confinement policy. When we're talking about adult solitary confinement, we're really talking about weeks and months that adults are sentenced to solitary, and perhaps even years. Of course, we know the horrific story of Albert Wood Fox and that Angola 4, but there are limitations on the use of what's called room confinement in the juvenile context for detention centers. Again, locally operated detention centers that hold kids mostly pre-trial, which are licensed by the Department of Child and Family Services, and that are, regularly inspected. Where is one of, and Where did investigate what happened. DCFS did investigate what happened at Where after Solon died by suicide, as well as there was another child who also took his life basically the same weekend. that was a horrible, horrible situation. And there were many deficiencies found. I will personally editorialize and say I don't understand how Ware maintains its license, but there were multiple deficiencies found with not only the checks not being administered, but there were deficiencies with the doors that in the cell that Solon was in, that where he was able to attach a sheet to the hinges, that should not have been possible. And so that, I don't want to go into the details, but the deficiencies were apparently addressed. And so that is how they were able to address the issues and continue operating. So DCFS does come in and they check those things. As far as how the licensing standards address room confinement. So first of all, there are incident reports that have to be kept when solitary or room confinement is used. And so there's some record keeping, but there are limitations. So I believe that the maximum amount of time that a child in a detention center can be held in room confinement is a total of 72 hours. However, I think we see from Solon's story that a lot can happen to a child in 72 hours, and that is an unacceptable amount of time when we're talking about a young child. Solon had just turned 13, and I think if you see a picture, I mean, he was a tiny little child, and these are kids, right? And an hour is a long time to a kid. And so, and many kids in detention are not even in the detention center for, much more than 72 hours sometimes. So that's a long time. And, kids aren't even entitled to due process according to the detention standards until they are in for longer than 8 hours. So I think there's some changes that could be made to the detention center standards. And I was hoping to accomplish that over the last year, and that certainly got waylaid by the pandemic. And so, but I also, there was some resistance to that. And so I think that, maybe looking to make some stronger legislative change is a direction that possibly we need to go in, to simply say this is just not an acceptable practice for children under any circumstances. And the standard that is recommended at the national level is that room confinement should always be voluntary. If a child wants to go into a room and blow off some steam by themselves and not be around others, they should always be able to do that. Involuntary room confinement, that should be if a child is in imminent risk of hurting themselves or another person, or of property damage that could endanger another person, that they can be in room confinement until they until they are able to calm down and then return. They should be immediately returned as soon as the general community, as soon as they can calm down, and no longer than that. And there are additional steps. There's an expert organization that I've worked with, that we've had some conversations with OJJ with them, and that have recommendations about how do you get mental health practitioners engaged. How do staff, consistently check on kids? How do you do that in a responsible way? How do you prevent kids from getting to that point? All these things are really important, but then you don't let kids just sit in room confinement for long periods of time once they've gotten out of that immediate crisis point. So that's the detention center. But I do want to add just one more point on that, which is that I think we have actually, I would say at this point, maybe missed an opportunity, but I am very concerned about what has happened over the past year with room confinement with COVID. I have no knowledge whatsoever about what has happened at local detention centers around the state when kids are being isolated, when they come into a detention center because of medical isolation, or if there's an outbreak at a detention center, because just locking kids in cells is a real easy way to accomplish medical isolation, but it is an inhumane way to do it. And I know that was happening at the New Orleans detention center when there was an outbreak. Kids were just held in their cells because there was really no other place to put them. So, so that is something I'm very concerned about happened during the pandemic. And obviously we're still in the pandemic, so that may still be happening. And I have some concerns about that. And we think it warrants a retrospective review. You know, obviously OJJ is here, they can speak for themselves, but I'll just say in general, these detention center standards do not apply to OJJ. There are no licensing standards that OJJ is subject to. There are internal OJJ policies. The OJJ policy for behavioral intervention, which is the term used for room confinement in OJJ, is pretty good. Ms. Deputy Secretary Summers knows my position is there is a part of that policy that I disagree with. And I have a concern about the unit at the Monroe facility that I do not care for. I think that the unit is very, needs to be shut down. So I know that kids are held in behavioral intervention rooms. My opinion is that they are held there for too long, and that we should be following the policy that I described before. Again, it's, you know, we don't have data on how much this is happening. OJJ, you guys might have the data, you can speak to that, but so I just say this to say there's generally speaking for both detention centers and OJJ, there's not a lot of transparency. There's not a across the board sort of limitation that says we just won't, you know, do this for kids. There's an acceptance of doing it to some degree that I think could really be limited. And we see from what happened with Solon that that the consequences of failing to not do this are tragic. And that is all I will say. I will stop there.
Thank you, Rachel. Appreciate all the work that you do through LCCR and the Peer Care Committee that I believe you lead up on just various task forces and just being able to provide that perspective. So I do want to just take a moment to allow OJJ to, if they like, I don't know if you have any perspective that you would like to share as it relates to this issue of secure care and the licensing component that Rachel talked about, as you know, as we're trying to really solve this issue. I mean, I just see it, this is something that we have to be able to solve. 2 kids in 1 weekend. I mean, 1 kid is too many, but this has to be something that we can solve as a state. I just can't see why we can't seem to just put the pieces in place to prevent something like this happening. So I'd like to give OJJ an opportunity to share their perspective.
Sure. Thank you, Representative Duplessis and Vice Chairman Ms. Womack. Just first of all, to Ms. Simmons, is that I actually had the opportunity to testify with Ms. Grassert and Representative Dwight on 158. And my former job as the director in Calcasieu Parish. We were actually, myself and my assistant director at the time, who is now the director, Anthony Celestine, we actually attended the bill signing. So our hearts go out with you, and that's why we took that very, very personally, you know, a couple of years ago, and it's still near and dear to me. So we have our, and not like obviously with you, but we took it personally on that. Solitary confinement is just not a good thing. I mean, it's not a good thing anywhere. Ms. Grassert and I have talked extensively about our unit at Cypress and the behavior treatment aspect of it. And we're working on that. As a best practice, we don't do solitary. They're checked on regularly. We do have a behavior unit at Cypress that I'm not real fond of, that we will one day, especially as we move forward, is hopefully do away with that unit altogether. As far as the detention centers, they're regulated by DCFS and they're licensed by the Department of Children and Family Services. There are stipulations to children being put in room confinement, and they are checked on every 15 minutes, like you said. Since that time, I believe it's even, you know, that's even pared down even more. Solitary and juvenile, It's not like it is an adult. And I know that's hard for you to understand, Ms. Simmons, because you had to live through just a terrible experience, but it's not near the same as it is in the adult system, where they keep them in there for days and weeks and months and years at a time. It is just like Representative Plessa just said, it is an inhumane practice, and especially as adolescents, and we start talking about trauma, and we start talking about triggers and whatnot. You put a kid in a small room, it's just not going to go well, especially if they have underlying issues all the way around. And I can sit here and I can talk about trauma and ACEs and brain development all day long, and where we're going as a group. We're bringing in my estimation, a very good Lamad coordinator who's human trafficking on the Human Trafficking Commission. She's ACEs trained. She's also a TBR practitioner. We're sending 3 of our units, or 3 of our social workers to TBRI training so they can become practitioners. We're going to take this throughout the state, not only on our secure sites, but our contracted non-secure sites, and every probation department or every probation office that we have in the state. All of our officers here in the next couple of years or so will be TBRI trained. And I think that really is going to go a long ways to way we build relationships with children, not just in secure care, but outside. There's a lot of things that Gina was talking about with the Children and Youth Planning Boards. Again, I have to go back to my former job where I was in Calcasieu, where I was our Children and Youth Planning Board chairman for 7 years. So I know how they work. I know how important they are in every district. And guess what, y'all? We didn't have a dime. We didn't have a dime to go forward with this. But we had a collective group of folks that wanted to see this work, and it did work. Calcasieu is not Shreveport, it's not Baton Rouge, it's not New Orleans, but it's a pretty big size area. And that group there now has, after COVID and after our hurricanes that we had there, they're regrouping, and they've already had a meeting. And so if you want to look at a good Children and Youth Planning Board, go to Calcasieu and see how Anthony is running. So there's a lot of things that I could talk about, and I know that you probably all have some questions and whatnot for me, and that's what I'm here for. But we're here to serve, and we're here to change the culture, and we're here to take OJJ to a level that's not been before. That's what I swore to do to the governor and everybody else, and that's what we plan to do. I don't want incidents that happen like it where it ever happened on my watch. I just can't. I can't deal with that. I can't. I won't accept it. So we're changing rules, and we're bringing in accountability and responsibility and commitment, and that's what we're trying to do here. So I'll shut my mouth, because I could talk all day about what we want to do and how we're going to get there. So I'll just be quiet, and if anybody has any questions for me that I can answer. And I know that Beth Morgan is on the line as well, and she can answer anything that I cannot, because I have not been here, for a very long time. Now I think I've got a less months than Dr. Brunley had at the Department of Education. So I'm still relatively new, and I'm still finding my way here. So I'll be quiet.
Thank you, Mr. Simmons. I'm sure we're going to have some discussion. I'm going to allow, Ms. Simmons, did you have some questions?
Yeah, well, I just wanted to, Judge David Matlock at the Voluntary Youth Justice here in Caddo Parish. I've been working with them, and I'm also a TBRI practitioner as well. And it's my hope that the training program can go into the schools, and work with the police departments as well, and get anybody that deals with children, so that we can keep these kids out of detention centers, because, it is what it is. But if, at least we got some kind of program to where we can work with these kids and the families to try to put resolve to that. But yes, I'm working with them as well. So
that's good. Judge Matlock called me when he heard that we were implementing TBRI here. Judge Matlock and I had a long conversation about how thankful he was about seeing us move in that direction. So Judge Matlock, I consider him a friend, man.
Oh, yeah.
Rachel, the Senator Gaddy resolution, that's been referenced a few times, as well as Melinda White's legislation. Do we need to reintroduce Senator Gaddy's resolution? Do you think that'll be of any benefit?
I think it, well, I know it's been expired. That's my understanding from the legislative attorney, but I think it could use a little tweaking. It was under the, it instructed the Judiciary C Committee to oversee the study, and I think it might be more appropriate for this commission to do so. Because it was actually introduced like right before the legislature turned over, and that's part of why nothing happened with it.
Right. So we should use this body essentially to be the ones to lead up the study.
Yes, that was
Okay.
my request of you all.
Right.
Thank you.
Okay. Well, I'm all for it. So I mean, I don't know if we need to.
And I would just add, I'm sure the Legislative Auditor's Office might be a helpful resource as well. I know that they have some info about, the use of Cypress at OJJ, and they might have some info about the detention center. There may be a resource that we could rely on too.
Awesome. To help in performing the study?
Yeah.
Okay. Well, you and I can certainly follow up on that and begin to put the pieces together to do that. So, does anyone have any questions for OJJ, Mr. Summers, or Ms. Morgan?
I do.
All right, Justice Griffin.
Mr. Summers still on? Oh, yeah, I see him. I had, following our last meeting, I'd asked for some information regarding the incarcerated youth that were incarcerated in adult prisons. We had talked about that at length, and that really the number of youth that were incarcerated, and just to give me some idea of what we were looking at from a statewide perspective. And I don't think I got that information. I don't know if there's someone in particular that I need to reach out to, or Curtis Nelson, who's also here at the Supreme Court, for him to reach out to on my behalf.
Justice Griffin, I believe that's in the report that we presented to Representative Duplessis, I believe, and Curtis, I'm not sure, did we get that information to you, Mr. Nelson?
No, and that was the request for the children who are arrested on an adult charge and placed in an adult jail while they're in OJJ's custody. Yeah, okay. I don't think we got that for just.
So let me apologize if I didn't forward that along to the rest of the commission. So that would fall on me. Let me or Ms. Womack get that to you all immediately. So I do apologize.
It's no rush, but it just I remembered about it as the presentation was going forward. Thank you.
Definitely. Yeah, we sent Mr. Summers a series of questions that were raised from the last meeting that they sent us answers back. So I apologize if I didn't pass that along. I'll make sure you all have it by as soon as we get off this Zoom. Yeah.
And if it's not on there, we'll get it to you in a heartbeat.
And I didn't have a whole lot of, well, I mean, there are some, but to respect everyone's time, because we're a little over time, I think just following up to set the date to do the tour.
May I have just one more, just 2 seconds, if y'all don't mind? Absolutely. I would like to say that beginning Saturday is that we will open visitation for our children in secure care. This was one of those things that fell on me, and I've said this time and time again. I don't know what it would be like to not be able to see my child for over a year. And I hope and I pray and I hope that y'all will join me in prayer is that this goes well. And you know, we're taking strict guidelines with our kids that are in secure care. But I felt like it was time that we go forward and try this. We're going to be having all, you know, all the PPE that we can do. We'll be asking questions. we'll be giving, people coming in with masks and whatnot. And so anyways, long story short is that we will begin visitation this Saturday. And we extended the hours. They're usually from noon to 4. But beginning this Saturday, it's going to be from 10 to 4 on Saturday and Sunday. And we just hope and pray that it goes like we want it to. And I know that it's just time. I mean, it really is. It's just time to move forward. And I hope I'm not making a gigantic mistake, but I don't think so. I don't think so. And I need some support, y'all. That's for sure. So, anyways, I'm done. So, thank you.
We're going to stand with you because we want you to be successful. We need you to be successful.
Thank you, sir.
As do our children, most important. I think we need to decide on where we're going to go, Gina, and then do we know yet? Because I know we want to visit somewhere. We want to all of those who are able and willing to take that visit. We want to try to plan something pretty soon. I'd like to do something because I think it just matters when you get to actually see the actual the locations of where of the issues that we're discussing.
I mean, I'm open to it, to whatever the other members are interested in, either Swanson or Bridge City or both.
Yeah, I think we said Bridge City is closer, so that might work better for everybody's travel. I think that's what we may have said. So,
other members?
Yeah. Anybody have any preference? So now the question would just be just getting a collective date, and that's something we can decide offline.
So other members, do you have a preference, Bridge City or Swanson? Are you all open to traveling? Swanson is 5 hours or so from New Orleans, so I don't know. We could decide offline as to not to hold up everyone.
Gina, I just want to throw out two slight dates to the committee. March 30th is when Mr. Summers will be in front of Senate Finance, and April 15th is when we will be in front of House Appropriations. So I know he will want to be a part of that tour. So those are just 2 dates that we have set on the legislative calendar already. Just wanted to get that out there for y'all consideration. But otherwise, if you contact me with any dates you come up with, I'll be happy to check the calendar and confirm, that date is good. But I just want to give you those 2.
Thank you.
All right. Well, any other questions, comments, anything anybody from the commission would like to share? I think we were able to cover a lot of important ground. We have a few action items that we're going to be following up on between now and the next meeting, which I think will be sometime in June. We will send around some dates after today's call. But obviously, there's a lot of work to be done. When we talk about the education piece of this, when we talk about the children's cabinet and all the work that they're doing, and really bringing it all home, working with the judiciary, working with law enforcement. There's so many more pieces to this puzzle that we have to work on to try to get right to best serve our children. I'm just, sometimes it seems overwhelming, but I'm excited about the work ahead, and that I think what this commission can do, especially even if it's just something about carrying the bringing back the resolution to research and look at secure care, and then making some legislative proposals from that, particularly around solitary confinement. So there's a lot of good work that we can use this commission for. I'm still learning a lot. And as I'm sure everybody on this commission is learning. So let's continue to just learn about these issues so we can prevent tragedies from happening, so we can rehabilitate children who end up in the system. So with that, I thank you all. Can I just
ask one last question? I was just ensuring that we're not moving forward on any prison rebuilds until after the tour, and that we can get more input. Is that still where we are?
Is that a question for me or for Mr. Summers?
Whoever can answer.
Okay. I want to make sure I understand the question. Did you say that we're not, go ahead.
Right, that we're not moving forward on the rebuild of Swanson or Bridge City until after we've had time to visit the facility and get additional questions answered. Is that correct? That's where we were, I believe, last meeting.
Mr. Summers?
Well, I can tell you this, is that bonds have been sold, you know, on this. Bonds have been sold at this point. As far as anything is going forward, plans have been done, bonds have been sold, and the move is forward. And I want to be as transparent as water here. As the move is forward to replace Swanson. And like I said, unless somebody tells me different, you know, if somebody comes in and says halt, a lot of this is out of our hands as things are in motion. They've been in motion, you know, for a bit.
So let me ask a follow-up question to that. As it relates to this moving forward of Swanson, and we talk about the mission of the 2003 legislation, does this get us more in line with what the goals of that 2003 legislation were, or does it take us in the opposite direction? I think that's really at the heart of it.
No, I think it gets us in line with more of the 2003. And obviously I wasn't here with that part of legislation, but we're talking about a significantly reduced secure care place center, you know, with a lot of the bells and whistles that you can put in a secure care, you know, structured towards rehabilitation. You know, I don't know how else to say it, except that, you know, right now, that facility that the children are in is 100 years old. And this will not be. And there's also that legislation about Bridge City, and the one in Swanson. At this point, I have not heard anything about Bridge City. The one when I got here, they were moving forward with was Swanson, not Bridge City.
Right. So while I would certainly disagree with your assessment that it would put us more in line with the reform. So are you saying you all have broken ground? Because I know the letter that Representative Duplessis sent prior to the January meeting requested that we hold off until we've had an opportunity to investigate more. So where are we in the process?
They have not broken ground by any stretch of the imagination. We would be reporting that to you guys, but they have not broken ground. The only thing that they have done thus far is sold bonds. They have sold bonds, and movement is going forward, you know, but that's subject to, you know, over my head, you know, change would be, you know, coming from a legislative body or somewhere else.
So there was some additional questions that we can send to you after this meeting, and then we can discuss further.
Sure.
Thank you so much for that information.
Yes, ma'am.
Thank you for that important question, Ms. Womack, and thank you, Secretary Summers. That's something we need to follow up on, have some serious conversation on, you know, and talk about the direction that we're going in with that. You know, we have exceeded 2 hours in this meeting, and I mean, it's hard to get through all of it in 1 hour. Obviously, we could do this for much longer, but, you know, we have to be respectful of everybody's time. And we know for a fact that that's going to be another, what we'll do is basically put that at the top of the agenda for next meeting, and talk about the process of the construction of this new facility. So, so with that, again, I said it before, I will say it again. Thank you, thank you, thank you. This could not have happened without Dr. Nagatu. I used to be technologically savvy. Now, if you send me the link, I still can't get on. That's how bad it is. It's actually embarrassing. So, you know, I just want to thank her again for making this process so seamless and for stepping in this role. And I want to also thank House staff members, Katie Lalou and Sadie Becknell, who had assisted us prior and leading up to this point, who were just phenomenal attorneys and legislative staff. But just because of the way that the law is set up, these Zoom meetings, we have to get it administered through the governor's office. And I'm just so grateful that they have stepped in to be able to allow us to host these meetings virtually. So with that, I thank every one of you for your participation and for your involvement. And I look forward to seeing everybody in June.